A very good morning to all who have just joined us at Tech Innovation 2021. The next program will be on reimagining health and wellness solutions post-pandemic through human-centric innovations and designs. Should you have any questions during the presentation, please type them in the Q&A feature on your screen. Your questions will be addressed during the panel discussion towards the end of this keynote session. I will now invite Hwei from Philips ASEAN Pacific and Design Consulting Asia to share his vision on how healthcare can be improved with disruptive technology. Hwei.
Good morning, good afternoon, or good evening, whatever you are dialing in. Thank you. I'll jump straight into today's discussion or sharing. And perhaps I just want to sort of put in context a bit of where we are in the state of healthcare. I think we are still in the midst of a pandemic, probably the biggest healthcare challenge that we have in our generation. And we are really at an inflection point in healthcare. Not so much brought about just simply because of the pandemic we are in, because this inflection point has already been with us before the pandemic. And this is simply due to a few powerful trends which is shaping the whole sector. And this is an important moment because that accelerated and also made more urgent by the pandemic. It puts us in the position to really think where we're going to head towards in terms of our healthcare ecosystems from now on. Obviously, it varies from country to country, from region to region. But essentially, there are two sort of routes which are facing us, is that we could take the healthcare system into higher resilience, which is very much the conversation that we hear around today, or that if we continue to go in the way that we have been conducting the whole healthcare ecosystem, we may run into a situation of impairment. So let me share what are the trends which are shaping this inflection point, again, against the background of what I'm going to share, but also with the whole pandemic situation. The first is actually there is a huge global resource constraint in the healthcare industry or in the healthcare sector. And as we know that it is getting more and more literally requiring more resource to look after and to maintain the quality of care. And this is due definitely to the growing population and also the increase of the chronic diseases that we are facing. So increasingly, what we are looking at is a conversation that shifts us from volume to value-based healthcare, where we are talking about increased access, how to reduce waste, which is a conversation in sustainability itself, and really focusing on quality of outcome. This is very familiar with Singapore, aging population, as with many other countries, right? As we know, by the year 2030, as many as a third of Singaporeans will be age 65. And this whole shift of that focus into aging population is really also shifting the kind of resource required to take care of this part of the population. And the thinking here is that besides burdening the whole acute setting, the notion of shifting that care into community is also something that we have to think about. And how do we do it at scale? The third trend, it's about increasing consumer engagement. And this is very much a trend which is played out through the digitization as we see. And of course, the best example would be the smartphone in our hands. I mean, it has totally transformed our life. And with it, it has also created a strong influence of how we look at healthcare, right? The relationship between us as individuals to the healthcare systems or to healthcare practitioners have completely changed, right? Think about Dr. Google, right? Think about the fact that right now we are able to know more about our well-being, and we are getting more comfortable to do self-monitoring. And likewise as well, in the pandemic recently, we also find ourselves getting more comfortable to engage in different forms of healthcare services, not necessarily always in an acute setting. And I think the increased health awareness and self-care is going to create also one of the big shifts of how we can go about with the whole healthcare services expected from us, but also how it can be delivered to the population. And finally, of course, digitization, as briefly mentioned, it is really disrupting, and it's in a way also developing, right, an approach which is very different from how healthcare has been delivering its services. The expectation of being connected 24/7 is exactly what consumers are looking for, users are looking for, patients are looking for, and likewise, the healthcare professionals as well, the care providers. And I think this creates an opportunity where that seamless connection between all these different stakeholders would provide, right, a great way of connecting, right, through the entire health continuum, right, but also at the same time be able to ease the transfer of information and data, which is so important in healthcare. So against this background, what we have done actually as a design team is that we felt that it is necessary at this inflection point that whilst the sector and all of us, in fact, the whole world are trying to solve the current problems that we see for healthcare, it is also timely that we take a look into the future and sort of imagine, right, what would it be? And we have deliberately sort of taken a particular disruptive technology, in this case, autonomous vehicle, to see how we could take advantage of its role and to see how we could really sort of disrupt the healthcare systems that we have currently. So this is a grounded hypothesis that we've created, and I'd like to present it in a form of a video. So please play the video.
Have you ever wondered, how will healthcare look like in 2030? In a decade from now, we will probably live in a world with infinite access to healthcare. Anyone can receive care at the snap of their fingers. And how, you may ask? Well, all of this will be enabled by one simple but fundamental shift in technology: autonomous mobility. Today, we see a continuing and concerning trend of cities building more and more hospitals to meet the demand of their growing population. This may solve the problem for now, but it is incredibly expensive and not at all sustainable for the long haul. So think about this. In 2030, healthcare is decentralized. Hospitals will only consist of crucial elements that require patients to be on site. All other functions will be redistributed and made entirely mobile in a network of hyper-connected autonomous vehicles. So instead of you going to the hospital, how about the hospital going to you? Firstly, what if you could receive seamless health screening on the go? Here, we have Nicole. On the way to work, she is empowered to manage her diabetes. As part of her mobile healthcare plan, the health cab discreetly monitors her status by running vital measurements, all in the comfort of her seat. For example, a biometric eye scan seamlessly measures her blood glucose level. Her insulin dosage is then adjusted accordingly and administered via the armrest. She then receives a reminder to top up her insulin subscription as she's running low. Wouldn't it be nice if you could enjoy prevention in your daily commute? Next, what if your doctor was always on demand and on the move? Let's meet Dr. Lim, a mobile clinician providing consultations from her healthcare vehicle. This morning, she has an appointment with teenager Jake for his weekly health coaching session. To begin the consultation, Dr. Lim activates the privacy screen. Jake's health and behavioral data appears on screen in the form of a digital twin. Dr. Lim notices that while he's in the pink of health, something is odd about his mental well-being. Her health assistant analyzes that negative exposure to social media has elevated his stress levels. Dr. Lim discusses potential areas of intervention, which Jake could adopt into his current lifestyle. With care available anytime and anywhere, now isn't that convenient? Moving on, what if you could really optimize your time in transit to the hospital? Here we see Nina in the company of her dad. They are en route to the hospital for Nina's planned surgery. A personalized healthcare vehicle facilitates a seamless pre-op process, providing a comfortable and well-informed journey. While interacting with her favorite cartoons, the hospital monitors Nina's vitals real-time through a smart bed. Prior to reaching the hospital, Nina is sedated through a transdermal patch on her arm. The vehicle's ambient environment gradually changes into a calm, relaxing atmosphere, easing Nina into a restful sleep. The doctor informs her dad that the surgery prep is completed. All vital signs are normal and they are ready to receive Nina for her operation. Imagine if surgery was that easy. Just close your eyes and go with the flow. Now, what if you don't have to be stuck in a room to receive a treatment? Let's meet Harry, who was recently diagnosed with chronic kidney disease. In a fully mobile future, Harry is liberated from the sterile dialysis chair and receives his treatment in a dialysis bus instead. He sits with his friends to catch up on the latest gossip as the vehicle seamlessly facilitates their dialysis process for the week. While they receive their treatment today, the dialysis bus takes them out of the city for a relaxing scenic tour through the mountains. How about that for your treatment? Just sit back, relax, and enjoy the ride. Lastly, what if healthcare systems could dynamically adapt to your needs? Various vehicular combinations could create pop-up environments for services such as health screening, respiratory treatment, or geriatric care. Here, we see clusters of vehicles moving around town to manage population health based on specific community needs. In times of emergency, these adaptive clusters will provide a dynamic response for accidents or natural disasters. Managing all this from a command center, the health system controller constantly evaluates the needs of each situation, redirecting relevant medical vehicles and resources to efficiently form pop-up hospitals. Could this be the future of healthcare management? A dynamic system to address our population's ever-changing needs. With healthcare this mobile, the future is full of possibilities. What else would you like to see?
So yeah, plausible, yes. Far-fetched, no. Well, I think it's exactly that, that the whole sort of speculation into the future, and these are scenarios that we've created, and probably it has to be seen in the light. It's like a concept car where not everything has to happen together, but to take bits of it and play it today. And that's exactly, just to finish off my part of the sharing, is with an example that we are doing it right now, is access to care. It's a project that we are doing in Japan, and we know that, in terms of access to care, it's been one of the biggest challenges in health ecosystems. It's a systemic challenge. Right? And in this case, Japan facing rapid aging population, the shortage of medical resource, and this we're referring to manpower, the ratio of doctors to residents, and the accessibility of those residents as well. In this case, that will be the elderly living out of the city. And the whole costly episodic based care needs to be rethink. And what we have done is to put together such a vehicle event that allows us to provide a service, and this is shared by 6 clinics, right? That they employ one vehicle that goes into the villages at fixed time and basically plays the role of a mobile pharmacy to do teleconsult, and also as a mobile clinic as well. So basically, it redefines how the residents receive care. Instead of having to travel all the way to the city, right, to do the checkup, to do a consultation with the doctor, it's all done right near to the comfort of their home, or even right to the doorstep, as you can see here. It's about remotely delivering those health services very much needed for those which are challenged in their mobility. And it helps to also mitigate the whole manpower in terms of healthcare professionals, right? They are able to serve a much larger population simply through teleconsult. Lower costs, right? As I mentioned about how the different clinics can come together and pool their resource to really sort of reallocate what and how they invest in healthcare services. And with this frequent call, with the vans going into the villages, what we are seeing is also starting to see a shift in terms of the whole preventative care part of it, that now that they have more opportunity to see the doctors and to do teleconsult, it actually contributes heavily and positively to whole preventative care. And this is a program which is running right now and literally a prototyping of the future. And that's a linkage of how we see distributed healthcare. I'll leave you with this and to what we'll be talking about reimagining the future. I think at the same time, it is about also prototyping it today. Yeah, thank you.
Thank you very much, Hwei, for that very exciting presentation. Next, Enrico Bassi from OpenDot Fab Lab will present the benefits of introducing co-design for all stakeholders in healthcare to create customizable products that can be produced locally with digital fabrication and new technologies. Enrico.
Welcome, everybody. Thanks for organizing this and having me here. It's a pleasure to be here and share with you our experience that's has been developed during the last 6 to 7 years and build up and prepared us somehow to what we faced during the last two very unexpected set of events. So if thinking about what to tell you today, I was trying to synthesize what we learned and what we think could be the way to go for the next years. And what we realized during the last 2 years is that technologies by themselves cannot save us. We've seen the difficulties to adjust to very quick, very fast change in the scenarios. And we can't hope that someone else from the outside, that the production system, that the companies developing technological solutions can fix everything. We think that together with technology, we really need to co-design, so to engage people and involve them in the development of the solutions. So our lab is an open innovation hub in Milan, and we focused on healthcare from a bottom-up approach. So we started from the idea that we can take care of people in different ways, even if we go beyond the simple treatment of a condition. And our belief is that to be impactful and be resilient, in particular when things change quickly, innovation should happen at every level of the system. So from the single doctor developing an idea to systemic change or big corporations changing their way of developing things, as we have seen before. And innovation requires to be shared and to be done together with others. We haven't found any other way to be impactful on a complex system so far. And last but definitely not least, innovate is not an option anymore. It's not something that we can choose to do or not to do. There are big challenges, and we need big change to face those challenges. So I just want to share with you a bit what I've seen during the last year and create a sort of a small scenarios from those projects that we put together in a perspective. So what you see here are some of the solutions that people developed for themselves. Some of the solutions that people together with maybe makers or designers created to face and solve their own healthcare challenges. And we collected all this knowledge during an international project that lasted 3 years. You can find all the results on careables.org. It's an open platform where you can find also the documentation for these projects. And we found 100 of projects and around 50 platforms online sharing all this knowledge. So all these great ideas, inspirational ideas that we can start from, understand, and work and build upon. So people has a great role in changing the healthcare as we know it. Not just people, but also doctors. This is the last project we've done with the Italian Society of Rheumatologists, so the national group that works on rheumatology. And we co-designed together with them solutions that they needed, starting from their pain points, starting from their daily needs. It's been a few months program, and we got to the prototyping stage of 3 different solutions. And the solutions integrated naturally what was their experience of the last 2 years of pandemics, of course. And they brought on the table knowledge that no studio, no design studio, no expert might have, because it was really the daily experience that they went through. So naturally, what they created were solutions that were partially physical, maybe printable for elders or foreigners that might have difficulties to use technologies, but also integrate the digital level and the technology, of course. There were systems to support people in the self-management, to reduce the number of times they have to go to the hospital again. Now, this idea didn't come from us. We as designers facilitated the process, but the core knowledge came from the doctors themselves. During the last 7 years, as I was saying, we worked with different realities, and one of the most beautiful is TOG. It's a foundation here in Milan, Together to Go. They take care of kids with complex condition for free. They do this amazing job, and they were saying on the market, we can't find what we need. So together we developed a lot of objects that goes from toys, inclusive toys for these kids, to simple tools to allow them to write and so on. And everything is done in co-design. So we really bring them in the lab, we do things together, we involve them in the process to be more effective. Very often we like to say that we might not be very efficient, not as the industrial system is, but we are very effective in taking care of the specific need that people have. So these bicycles, for instance, are fully digitally fabricated. They come from a digital file that is customizable every time. We do that together with the therapists. So all the movement that these children do are actually right for their condition. It's a part of their therapy, and it's not just a toy or a way to entertain themselves. You can co-design at every level, and even on very large levels. We are working together with the design studio that founded our lab on designing the user experience of the new hospice that will be built in Italy. It's a huge, beautiful project. And there's nothing there yet, not even the first stone. We are really thinking things from the bottom, and the bottom are the people that are going to use this. So we spoke with the families, we spoke with the siblings of these children that needs constant treatment or periodical treatment, to understand them. What is the problem for them to stay there, how they want to interact with their siblings, with the other kids. We talk to the doctors, to the associations, and all together we are figuring out how to solve or improve their experience through the entire time that they have to spend in this place. Now, the specific case of COVID-19 was a sort of global call, and people reacted to this call. Actually, Italy was one of the first one that did that, mainly because it was one of the first country that was hit by the pandemic after China. And also because of this very famous case that you might have seen on newspapers or news in general. So there was a lack again, of industrial products to do Cpap, so to do the treatment to facilitate breathing for the patients. And a doctor called a small studio, I would say a sort of maker studio somehow, because they had this idea on how to adapt and adjust a normal object, a snorkeling mask, to become a temporary Cpap mask. And this file has been shared and printed all over the world. These guys has been on the news. They shared openly everything that they developed, and that was amazing. And through open design, this project evolved and it became adjustable to other masks. And that was the first example. But from this example, other developed. And this is another case I really like, also because it started from the idea of a doctor in Taiwan, if I'm not wrong, Dr. Hwei, that has this intuition to use a transparent box to reduce the spread of the virus during tracheostomy. The project has been published, and another couple in the US found it and decided to spread it furthermore. So they made it easier to replicate. The couple is actually, he's a doctor and she's a designer. So again, the contamination between two words helped out. And they supported hospitals all around the US to actually get one of these intubation boxes. And when we talk about a globally response, this is what we're talking about. So in less than a year, 43 million objects has been produced and delivered. And the development of these solutions were like weeks, not months or years. And also the impact that this had on economical scale was huge. So there's really the possibility to distribute how we innovate a system. So when I say that innovation, as we see in it, is really global and impact everybody, this is what I mean. Everybody has a role in this change. So companies can open up and take ideas and solutions, be more open again, and do open innovation to collect the best of the collective intelligence. We have seen hospitals running innovation programs. We supported them somehow to collect the best ideas from their doctors. Policymakers has a crucial role because sometimes in regulation, they close up too much. While it's important to regulate something new, but also support the development of something new. Universities need to change the way they teach things. Innovation happens in the boundaries between different courses, between design and medical training, and makers can go on experimenting, of course. So everybody, in my opinion, should keep in mind this three way to be open to innovation and be part of it. And it's really cooperate. Don't be afraid of learn new things and get cross-pollinated by others. And sometimes we have to take risk and explore unexplored territories, and we will meet people there, innovators there that could help to bring on our ideas together. So thank you very much for the opportunity to talk to you.
Thank you very much, Enrico. Following Enrico Bassi's interesting presentation, Jerome Go from EPAM Continuum will focus on the opportunities in health and wellness post-COVID and tactics to use in order to seize them. Jerome?
So, one of the things that for me that's very interesting is that we're living through this period of COVID, right? And for a lot of us, I think for all of us who actually have lived through this time in the modern age, this is the first time that we have had an event that has had global impact in our lives. It has actually touched everybody's lives. And for a lot of us who have lived in this very prosperous times, we have not had an event like this that has happened. And for me, as somebody who practices innovation for the last 20 years, one of the things that I do is always am on the lookout for opportunities, because I'm preternaturally inclined towards optimism and positivity. Always looking for the silver lining. What are the things that is coming up despite the fact that the situations have always been very bad? So some of the topics have already been covered by some of my other panelists, the fellow speakers, but I was going to go through some of my reflections and observations of what's happening today. I'm going to go through two that are pre-existing that Hwei actually covered quite a bit, but I'll give my spin of it, and then two that I think is quite interesting that might portend to things that might come up in the future. You cannot talk about the healthcare, you cannot talk about health and wellness without going into healthcare, right? I've worked for many healthcare organizations. My career primarily focused for the last 20 years in the US. There's always been very interesting problems that come out from the healthcare system there. The industry will definitely evolve, right? But they will evolve at their own speed because they are big and enormous ecosystems of interconnected companies that are doing things together. I think what's interesting in the healthcare systems is there will always be improvements that will go into the future. Some will be more disruptive, like things that are happening with COVID. Others are things that will happen along the way because of the fact that, they've always been in consideration. And, one of the things that I think is going to happen is there's this article that I am showing on the right that one of my colleagues has talked about, which is this kind of digital consumer healthcare platforms that's going to actually be quite disruptive in the future. The other thing too that you can't talk about, when you talk about health and wellness is the wellness industry, how we exercise, how we seek medical help, all of these things, the food that we eat. COVID has brought a lot of disruptions. Some of these companies have actually gone by the wayside and have gone out of business, but others have come along the way to actually, replenish the companies that have gone out, right? And even before COVID, we know that data and AI is going to be like a big thing that is going to change this industry itself. So these are the two pre-existing ones. But the ones that are very interesting that I am observing right now, these two pictures on the right, and for those people who are not from Singapore, you might be wondering, like, what in the hell are these things? The one on the top is actually an oxygen monitor that the government has given out to every single household in Singapore. Kind of amazing. And when we were talking about this before as a group of people, one of the things that Cheaw said was, the last time that the consumer had something that you could self-diagnose was a thermometer. That was the last time that we had a self-diagnosis tool. And today, we have two pieces of self-diagnosis tool. One is the ability to be able to test whether we have COVID. And the other is if we have COVID and are vaccinated, we want to make sure that our oxygen level do not fall below a certain level. It reinforces what Cheaw actually talked about in the beginning, in that increased self-help is going to be in our future, right? Together with digital technology, this is going to happen. The other thing that's going to happen that's very interesting is the business models that is going to come up. I've always been scratching my head, like whoever is actually in the testing business is going to be very wealthy, right? Because the governments have actually not figured out how to share records. So in order to be able to verify that I'm actually free of COVID, I can't show my vaccination record, which is the better way to do it, I think. The only way they can do it is test. And there was a story that, I had a colleague who traveled to Ireland and he had to go back to the US and their flight was on Saturday, but then the COVID test had to be done 3 days in advance and they had to figure out whether they could do it on Thursday or Friday. If they did it on Friday, if the results came on Monday, they would not be able to get on the flight. So this is kind of a problem for a lot of us, right? So these new business models where people are going to track results, people are going to do the testing, this is going to boom and you're going to see these new industries that's going to come up. So lots of great opportunities, but what's really interesting, like what Cheaw said too, is that it's not just one company doing things anymore. It's a lot of companies interconnected together, healthcare companies, tracking companies, digital companies, making companies, like all of these have to come together to figure out how we're going to work towards a solution that can be usable for the end user. Now I'm going to stop my story for a moment and go on to this other story that I will connect at the end. Now, I'm an advisor for a startup in the US called Forbes Ignite. And Forbes Ignite is a group of, is a consultancy that runs these communities of experts, and they pull together a women fellowship of medical professionals. And one of the things that they asked me to do was to actually help explain creative problem solving, right? So I gave this talk, talked about the wonderful projects that I did. I showed this project that I did in my previous position that was to design the space that fit this particular children's cancer hospital. They had a very unique business model and a way of doing things where the patients who were there for long-term care stayed offsite. So we designed this specific facilities for them. It was a really beautiful story. I shared it. There was a lot of tears, patients were very grateful, all that kind of stuff. And then one person quipped up and said this: "You can do this because you're a consultant, but as doctors, we have policies and limitations to abide by." It kind of made me shocked because it was like, I don't exist in a different parallel universe than the doctors and the nurses that I designed for. We live in the same world. And it made me realize that in all of these, mindset is actually very important. So when we talk about reimagining, right, everybody knows this today. The innovation process is very important, and you have to have a user-centered innovation process. I'm not going to go very deep into this because this is something that everybody knows about. We also know that data-driven dashboards are also very important because they help us understand, they help us predict, they help us see the gaps. And as a consultant, I cannot but put in a case study of like, you want good consultants to help you. You want them to be able to help you come up with creative ideas. You want them to be able to see where the opportunities is. And in this particular case, you were able to leverage their existing partners to be able to build upon it so that we could deliver a solution for them in 8 days, right? For something that they needed to be able to communicate with their patients, online while they couldn't come into the hospitals. So, the right mindset is a very, very important starting point when you go on the track to reimagine health and wellness, right? So one of the things to watch out for, right? In a complex system like healthcare, it is easy to be bound by institution and legacy. I hear these statements all the time. We can't do it because, we're bound by policies and regulations, like the first person who said it, during my talk. We have done this the same way for many years. It worked really well. Why do we need to change, right? And the last one is, I like my role here, right? There really is no need to change. So I think when we get onto all of the things that Enrico and Hwei is talking about, as business owners, as designers, as even people who work in the healthcare system, I think the most important thing, if nothing else, is that you need to free up your mind to take the first step. The first step towards innovation is the most important step because it's the step that actually helps you understand whether you're going to go into this with an open mind to be able to come up with very innovative ideas that have been shown by the other panelists, or whether you're going to be limited and operate in the very same way that you've always operated before. Thank you.
Thank you so much, Jerome, for that sharing. As we will be moving on to the panel discussion segment, we would like to encourage you to submit your questions in the Q&A feature on your screen. Our 3 speakers will be back on screen together with Lo Hwei moderating this panel discussion. Over to you, Hwei.
Thank you. Thank you, Enrico and Jerome. I'm just fascinated by what I've been hearing, actually. I'm seeing actually a flurry of questions coming in here, and I think I'm almost tempted to just throw away all the questions that we were planning to ask ourselves in this conversation, because I think we really the content that was shared really evoked quite a lot of curiosity, but also very good questions as well. But maybe before we go into those questions, and we'll attempt to answer them, is that to Jerome and Enrico, now that you have heard what we have collectively shared, right? Can you just briefly share your view then about that reimagination of the health and wellness, right, post-pandemic. Because maybe I just shape it a bit, is that it seems that there is a good correlation to what we were sharing, right? From mindset and going into how do you land the innovation, right? From you, Enrico, and I was trying to describe what would be the future ecosystem. So almost in those concentrics of those contexts. So perhaps Enrico, what is your thoughts after hearing all this? Just a quick thought, just to get us going.
Yeah, I think that there is a very big connection between the project, even if we come from different backgrounds, different scales. And the key point is really moving from a self-centered idea of innovator to a more shared and distributed idea of innovation. It's not anymore about the people, everybody has a role. And even what you were talking about, what you're doing in Japan is a very nice example of the power of distributing solutions as well, not just innovation. And it really comes to the mindset, as Jerome, you were saying.
Yeah, indeed. Jerome?
I think the thing for me that's really interesting is where would there's so much to do in healthcare. That's the thing. The healthcare is a very complex system, and in different countries, you have different problems to solve. I think there's so many things that I could have said, but I didn't touch. And one of the things that we should be very concerned about is healthcare is now becoming even more distributed, in the sense that for people who have access and who have the financial ability to be able to do it, it's something that then they would be entitled to. But then there's a whole other category of people that is not. Right, and both of you guys touch a little bit on that, and I think that that's something that maybe hopefully that I would have the opportunity to work on, that people will approach us to be able to help them, solve these kinds of issues as well. Because healthcare is not about just business; it's a societal problem that we need to actually make sure that everybody has healthcare in ways that would benefit them as well.
Yeah. Yeah, so maybe I'll give my take to it, right? I think what I'm very intrigued by what Jerome, you presented, and also Enrico, is that I don't usually use the word empowerment because I really don't like that word because it's so overused, right? But I can't help but to get this sense that actually through technology, there is that self-help part that you talked about, right, Jerome and Enrico. I think what you are doing, what you were just sharing also, especially let's say with all those 3D printed hacking of the snorkel mask, right, for Cpap, right? That is also empowering through 3D printing, right, to respond to a problem very, very quickly away from those typical manufacturing setup. And I think those are really inspiring. So maybe with that, I'll go into some of the questions, and maybe I'll start off with one that is addressed to all three of us, right? It's a bit long, but I'll read it out. So the question goes, how can we begin to introduce these futuristic concepts to the Singapore healthcare ecosystem? Should education on basic healthcare tips be mandatory for more people to engage in personal healthcare monitoring? Jerome, you want to have a go at it?
I think the thing for me is, as somebody, a confession time, right? I lived for many years in the US. I'm one of those Singaporeans that left Singapore when I was young, and then now I'm a returnee. So I have had the experience of living in a different country for a long time, and seeing what the government has done has already given me a lot of kind of like, just appreciation for the fact that the government tries to actually accommodate people. And a really great example is the Trace Together app, right? In the past, I had people who were older having problems with the app, and they obviously had the token, but the token is not enough. And one of the things that they've done is that they've actually now designed the app so that you can bring in older members of your family or even younger members of the family. I think the fact that the government is constantly pushing and not resting on its laurels is something that I think is really nice. And the fact that they're constantly thinking about this, is a really great way. And I'm not saying that, Singaporeans need to just sit back and relax and let the government do all of it. Yeah. Now, obviously, I think what's opening for us is a lot more choices. right? There are many, many different ways to engage. And I think that that's a great thing. I hope that the government can still open this even more so that the core business of healthcare itself, can start to transform and become much more a kind of like a participatory kind of a thing, to the point that what Enrico is talking about.
So Jerome, basically what you're saying is also that government can play the role of providing the enabling conditions, right? But we should not sort of rely on government to be 100% taking care. I mean, to your point about that whole self-help, right? Your examples of the recent oximeters and the test kits and so forth. Yeah, absolutely. Enrico, how do you think of?
I don't have, unfortunately, direct experience on the situation in Singapore, but I feel that everything that happens around us, in particular when it's on a global scale, that can be solved only on a global scale, really needs to consider the variability of planet Earth and humanity. So that's the biggest challenge I think that COVID is bringing on the table. And there is always to balance two things. On one hand, people want simple solutions, and companies are happy to provide simple solutions because that's what people want. But on the other hand, people need to take responsibility and be an active part of the solution itself. So every time that there's a challenge, it's also an opportunity to learn something new, to evolve and to gain new skills. So one of the key problems with people, for instance, that are not convinced about vaccination is not about the healthcare challenge of COVID, is about how we teach technologies and the scientific method in schools around the planet 20 years ago, or since the last 20 years. So being innovative is really to try to tackle all the points that are connected together and do that in advance, I would say.
No, thank you for that. And maybe I'll add to it. I think it was a good question actually to ask on this, right? And my take would be actually that I think true to what we have been sharing is that if I may take the recent vaccination exercise which many countries are going through, and of course the experience here would be the one in Singapore, right? Very well run, very successful, right? Very efficient in that sense. I think that with every opportunity, we should also be reframing such population-wide kind of exercise. And in my view, is that perhaps the vaccination should be reframed not as a clinical exercise, but it's actually a social exercise where you need to mobilize large population, right, to be comfortable to go into a community center to receive an injection, which in itself I think is changing already the whole behavior and the mindset. So I think to that question will be about how do we take opportunities and start to shift behaviors and mindset and not have the expectation that all healthcare services has to be delivered from a hospital or in a hospital. Yeah. Okay, great. So now that we have you, Enrico, there's a question quite specific for you, is that it asks, from your experience, what would be the best way to address and overcome legacy issues, right? Freeing one's mind being one of them. And I think this is a question directed to you, but I think also, Jerome, you can chime in as well. It's about mindset.
Well, my personal opinion is to start small. We recently created an international group called the Fab Care to collect the effort of different groups around the world that are working on building, literally making a new approach to healthcare. And in our platform, we shared a 10-step list from the easier to the most complex. And very often the easiest thing is really to be hands-on on some projects, to be in contact with someone with a different background from you and just experiment. It might be not successful at the beginning, but it really builds up in your mind. Just a small story, if I may, a few seconds. One of the doctors we worked with a few years ago, we worked to develop a prototype of his idea, and he was his mind was blowing out because of how quickly you can prototype something. No? And after a couple of days that we were working on this idea, he said, I was thinking about this since the last 3 years. How come is that easy to actually make it? Now I can do the test. And he did a published paper. He patented his idea, and now he's bringing it on. Now, because he was that impressed about the technology, he bought a 3D printer and he started to play with that. And when the pandemic hit, he was the one in the hospital giving suggestions on how to do things. He was the one that has the knowledge on how to improve the designs that he was finding online. And it was really a melting pot between, technology, knowledge, and medical skills. So I really think that the best way is to start from something simple, not be afraid, and know that everything new will go through failure, and that's the natural evolution of
Absolutely.
every experience.
I remember what you said in your presentation. You used the word the contamination of the designer and the doctor. Of course, it's good contamination. So, yeah, indeed. So, Jerome, same question to you. What would be the best way or ways to address or overcome some legacy issues here? I mean, I think yes, yeah.
I want to build on to what Enrico is saying, right? That starting small is always great, so that you can always see success. Because I think one of the important things when you do these types of things, when you innovate, is you don't actually kind of know where you're going. So if you're trying to take this big leap in order to reinvent the entire system, it's impossible because you're not going to know whether you're going to be successful or not, right? So taking small steps is really important. But the other thing that I wanted to build on that maybe Enrico sort of like skipped over is the fact that, the story that you had about the doctor is a really beautiful one, right? Because one of the things that I do is I'm also an educator and I teach design thinking, in schools as well, but also in corporate settings, because companies love the way that we do things and they want their staff to do the same thing. And in all my 20 years of doing this, I've never found one single human being not creative. We are inherently creative people. It doesn't mean that if you're a doctor or you're in the industry that you can't be creative. All you need to do is to free up your mind. Like the story that Enrico talked about, it's such a fantastic story because it's not that Enrico came up with the idea, it's the doctor had the idea, right? And that's the beautiful part of this. We have to remember that all of us are inherently creative people.
Yeah. Likewise, I picked up the very remark, right? That idea didn't come from us, and I thought that's actually quite liberating because we tend to think that, hey, designers, you are the one to come up with the ideas. Please, you think, you be creative, right? We'll just sit back. No, I don't. I think that's a myth actually, right? But the role of designers has actually changed, and that will lead me to another question, which is actually addressed to Enrico. About the question about the maker movement is very commendable, right? Can you share best advice to those aspiring to take the same approach, right? For people thinking of starting something like this? Enrico?
Well, the nice thing about the maker movement is that it's very inclusive. So it's really easy to get in contact with the people in local Fab Lab. I know that there's one in Singapore. I know that there's an international group of Fab Labs that puts together all the Asian labs called FAN, I think. It's there is an international meeting every year, and you can find a lot of information online. And then again, very often it's enough to reach out. So if you want to be a maker or if you want to integrate that in your company, let's talk about it. I'm happy to introduce you to people if that's what you want. This is what I'm talking about when I talk about contamination,
Absolutely. Talking about prototype, I see a few questions for me. It's about the that whole mobility healthcare van project that I shared. I'm going to tackle in those few questions in one go. The question is, where is Philips in this Reimagine Healthcare 2030? The first one. I think that is exactly that. As a health technology company, what we want to do is to basically throw a hypothesis out there, and in this case, it's a grounded hypothesis, right? To help us really work towards that those few scenarios of how healthcare can be distributed, solving the issues of not burdening right? That centralized kind of healthcare setup that we have. So I think our role is also to look into what technology would enable that, but always putting the patient, right, the user, the individual, and also the healthcare professionals in the center of that discussion always when we build the scenarios. There's also a question about that mobile clinic, right? What has been some of the challenges in scaling it up? I think we are going through a pilot. It's actually a 2-year pilot in a few prefectures. So, and that's exactly what we want to learn from it. I think we are anticipating that the challenge is actually coming from 2 things mainly. One is actually the people behavior, right, of accepting such a service. And the other, largely, I would put it, is actually healthcare logistics. I mean, it is all about organizing logistics. And I think that's something that we also want to prototype and test out as well. The last question there, how long can the mobile clinic be on the road for? Well, it depends. I mean, it's a van, right? I mean, it can take as long as the fuel carries it. But of course, in terms of technology, it is wirelessly connected, but we also got to think about the people who's going to be in the van delivering the services as well. So I think it's exactly what the prototype is for, right? Conceptually, it works. Test it out. What is the experience that the people have, the villagers have, the elderlies have, right? And how the service providers is able to augment this in context of what they want to deliver. And from there we learn, and then from there we iterate, go back to the drawing board again. And yeah, I think, you know, we managed to clear all the questions. There are a couple coming in, but I think I see Alvin stepping in already. So I believe this is towards the end of the discussion session. So thank you to Enrico and to Jerome. Really inspiring. I mean, it's I think we should just continue our conversation offline. I mean, it's fantastic. So thank you very much.
Thank you.
Thank you.
Thank you very much, panelists, for that very, very engaging session. Now, we have come to the end of this keynote session on reimagining health and wellness solutions post-pandemic. Thank you to our speakers and to all attending this webinar for your active participation. Please click on the info button on your screen to submit a rating out of 5 stars and your feedback before exiting this session or joining the next one. During the break, check out our key partners on-demand technology showcases by selecting 22nd September under the agenda drop-down list. You can also chat, secure a virtual one-to-one meeting, or request for a call back with exhibitors by clicking the Connect button in their profiles. Now, if you're interested to speak to IPI tech experts, simply search for their names via the Attendees button. We'll see you after the break at 1 p.m. Singapore time for the next session on non-invasive diagnostics in healthcare. Thank you once again.